All right. How is everyone today?
Hi, how are you?
Good. Well, it is 6:05, so we are going to get started. And if anyone does come late, they are welcome to join us. Obviously, there is refreshments. There are some chips and sandwiches in the back, so please help yourself to everything. And I'm Erin Lambie, if you don't know me. I am one of the school counselors here in the district. I've been here at McGuffey for 18 years now. I was at the elementary for a long time, and then I moved to the middle school and get to enjoy the middle school students now too. So I've been helping Dr. Welk with finding our presenters for our parent series. This is our second one. The first one is, if you weren't able to attend it, it is on our website now. So if you go onto the McGuffey website, you'll find the link for the parent series, and you'll be able to view that video. This one will be recorded as well, and we'll have it uploaded. So please let your friends know. Please let other community members know that these will be available for them to view. I'm really excited for tonight's presentation. We have a wonderful panel of presenters for you. So I'm just going to do some brief introductions, and then I'm going to hand it over. Our first presenter is Celeste Wilhelm, who is an advocate and volunteer through the Western Pennsylvania chapter of the American Foundation of Suicide Prevention. And Celeste is going to be sharing with us a presentation titled More Than Sad, to inform us about suicide awareness, statistics, and prevention. After that, we will have Julia Lacey, who's from the Southwestern Pennsylvania Human Services. Julia has a master's in clinical mental health counseling. She's worked at the crisis unit in Washington County for about 2 years, specializing in school-age children. And she also has previous work experience as being a school-based therapist and a therapist at New Directions Partial Hospitalization Program for Children and Adolescents. And then finally, we're going to have Dr. Mary Jo Krajewski. Many of you might be familiar with her. She's actually doing another presentation right now somewhere else. She'll be attending here at 7. So when you hear my phone go off, and I'm going to escape for a moment to welcome Dr. Krajewski in, so that she can be our final presenter on our panel this evening. Dr. Mary Jo Krajewski is the president and founder of the Academy of Adolescent Health and the founder of the Washington Health System's Teen Outreach and Education Programs. Dr. Krajewski has a background in nursing, education, and in counseling. She has authored 38 books and received many distinguished awards throughout her career. So I'm very excited to have all three of our panelists with us this evening. Now I'm going to go ahead and pass it over to Celeste to start. And if you just want to clip this to yourself.
Yeah. Thank you. Hi, everybody. As she said, my name's Celeste. I'm with AFSP, and I've been a volunteer there now since 2015. So I started off, I'm a facilitator for support groups for people who've lost someone to suicide. And then in the last 3 years, I started doing presentations. Normally, I'm presenting to students. So Jesse or Jamie would be here. That's the normal people that would be doing these presentations, but they weren't able to be here, so I'm the pitch hitter, I guess, so to speak. If for any reason if you're uncomfortable with something I'm saying, makes you uncomfortable, anyone's welcome to step out at any time. Also, I like to run a really informal presentation, so if you have questions, if I say something that doesn't make sense, this presentation is for your benefit, and so I want you to get the most out of it, so don't hesitate to stop me and say, what did you say? Or, ask anything of me. If I don't know the answer, I can definitely find out for you, or our other presenter might have good information better than I. So let's see. Okay, so the goal for the presentation is to learn about teen depression and suicide. We're going to talk about warning signs and risk factors for suicide in teens. We're going to talk about how to understand the role of treatment in reducing that risk, and also about how to identify or how to approach your child about talking about suicide. Warning signs and risk factors are the two main things we're going to focus on first initially. So suicide ideation, I think that term is used so often, and so many people really don't have an understanding of what that means. Suicide ideation is when someone is thinking about or planning suicide. So instead of saying someone's suicidal, suicide ideation is a term that's used quite frequently, and you'll hear it throughout my presentation. And sometimes people think when teens talk about suicide that they're just trying to get attention, that they're just trying to get people to pay attention to them. However, anytime anyone mentions suicide in any form, joking, seriously, it should always be taken seriously, because that's just not something anybody should joke about. It's something we should always pay attention to. So risk factors. So that's the first thing we're going to talk about. There's three main ones we'll focus on, and that's health, historical, and environmental. So by health, sometimes within a family there might be biological or psychological things that tend to run in a family. Just like high blood pressure or diabetes run in a family, sometimes there are psychological things that run as well. Historical factors, things that have happened in a person's life or their family history could affect them, and environmental factors, such as social or cultural factors, are also things that should be taken into consideration. And the thing to remember about this is just because there is a risk factor present does not mean that someone is going to be suicidal. Just like if you have diabetes in your family does not mean you're going to have diabetes, the same is true for mental health issues and suicidation. Any questions? Okay. So one of the first things we're going to do is look at research, and it's shown that most people who die by suicide in their lifespan have a treatable mental health condition. So it could be diagnosed, or it could be something that they themselves have never recognized, or maybe they're aware of it, but they're afraid to say something to somebody. So, you know, I'm really big on, and the reason I do these presentations is I think we have to normalize mental health. It can't be something that's mystical or hidden or talked about, you know, in whispers. I think, you know, just like you talk about your physical health, you need to address yours in the same way. So normalizing that, because that way you can detect things early on. You can identify issues before they reach a crisis point. So I think the best way to do that is by normalizing mental health. So many people who die, oh, I did that. So teens who attempt suicide do that as a result of many factors. You know, I think sometimes when you see a celebrity die by suicide, they identify one thing. It was drugs, it was alcohol, it was whatever. And it's never just one thing. It's so many things coming together at one time that results in them not being able to see a way out and experiencing severe pain, and that's what that leads to. So by identifying and by talking about it and by being aware of it, we can identify those risk factors and reduce the risk of suicide, because that saves lives. I mean, and that's what we're all here for. So the next thing we're going to talk about are common mental health conditions. So once again, major depressive disorder. That would be someone who is suffering from depression. Conduct disorder might be antisocial or very aggressive behavior that you might see in students or teens. Generalized anxiety. So I think anxiety, that term is just used very frequently today, you know, as a catch-all. But really, when someone's experiencing severe anxiety, they just can't calm down. They can't settle. It's just something that they're worrying constantly about everything. And bipolar, meaning like mood swings or manic depressive, schizophrenia, eating disorders, and a lot of times if a person has an eating disorder, they may have issues with depression too. So, you know, there are things that are linked together. Any questions on that? All right. So, environmental. So bullying in and of itself is, with suicide, is a very complex issue, right? Because bullying alone, by itself, if you have no other mental health risks or anything else, that's normally not going to lead someone to suicide, right? Bullying by itself isn't an issue. It's bullying somebody when they have other underlying, so if they have anxiety, depression, by being bullied, they can experience despair or feeling very excluded, which then exasperates the other conditions that they have, and the combination, once again, it's such a complex thing, combined together, and that's when you get that student in trouble with suicide. Bullying behavior is also an issue for the bullier. You know, I think we always focus on the person who's being bullied, but the person who's bullying also has to have some underlying issues that they are unable to express appropriately, and they express it through bullying other people. And so I think you have to look at both parties in that instance and try and help both of them, because that behavior is not normal either. Any questions on that?
I do.
Yeah.
I was just curious by the comment, because you honestly believe that a child can't be bullied enough that they would attempt suicide when they reach their end of it?
I don't think that I would ever say a period within psychology,
Okay.
right? But I think that if they're being bullied, yes, it's going to affect them. I'm not in any way trying to minimize the effect of bullying. So that's not my point. My only point is, if a person's being bullied but they don't suffer from depression, they don't suffer from anxiety, bipolar, any of those things, then most likely they'll be okay and they're not going to go the route of suicide. I can't say never, right? Because you just don't know. But typically, the way that it's played out, and you're more than welcome to jump in, it's not just the bullying that's going to push a person over.
Okay, thank you.
Sure.
I'll touch base on it in mine a little bit. A lot of the times, like when we talk to someone about bullying, when we kind of dive more into it, there's a lot more going on when they're having the suicidal ideation on top of the bullying. Sometimes they're depressed, sometimes there's issues at home, or maybe they're just struggling period. So I'll kind of dip my toe in that as well a little bit during my presentation.
Yeah.
Thank you.
Yeah, I'm not minimalizing.
No,
Yeah.
When you said it, I was like, what?
Yeah. So that takes us to social media. So social media is evolving. It's something that I know they're researching actively. I think social media poses a risk for students on a massive scale. That's my personal opinion on that front. I think that the kids that are suffering from depression, anxiety, when they look at social media, especially some of the bloggers, you know, their life just looks so perfect. They have the perfect hair, the perfect boyfriend, the perfect clothes, bedroom, everything, and that's an illusion, right? That's what the perception that they want you to have. But somebody who's suffering from other anxieties and other mental health issues, they're not going to be able to see through that facade, and they take it so personally, and it can become something that's very depressing. So I think the other thing you might see on social media, and I really stress this when I do the student presentation, is you may see kids expressing things through texting and through other posts that they're making that really start to question, where are they? You know, maybe they're a big person that posts all the time, and all of a sudden they simply stop and they go radio silence. That's something you want to investigate. They may post comments, you'd be better off without me, you know, things that lead you down the path of thinking, hey, there might be something wrong. So when we do the student presentations, that's something that is very much stressed, in that you have to listen to what people are saying, not only verbally, because let's face it, kids today would rather text, at least mine would. They would rather text than talk, you know. If I say call someone, they text them. I'm like, that is not an interchangeable thing. That's two different things. So I think you have to really pay attention to that. I also think heavy use of more than several hours per day of social media is detrimental. Many families today, you know, they go radio silence. You know, you have a week where nobody's allowed to use any technology. And I think initially kids balk at it, but if you plan fun and family things and you break that mold, I think it just opens up their eyes to all the different things that maybe I did as a child, because there were no cell phones then. Any questions? Okay. So the next, I'm not sure how this works technology-wise, but the next frame is a the Chief Medical Officer, Dr. Christine, I think you say Mortar, who she's going to talk about risk factors and warning signs. I think when I flick it, the video is just going to start. It did work earlier, I swear. Yeah. Because she does a brilliant job.
It's not just about whether life is worth living. Suicide is a health issue.
That's not the beginning. Sorry. I'm going to be on that.
It's not just about...
Maybe we'll just let it go from there.
It's not just about whether life is worth living. Suicide is a health issue, and it's largely preventable. Suicide happens when multiple factors come together, so it's not related to just one cause. You can think of the underlying risk factors for suicide in 3 different buckets: biological, psychological, and past history. Biological risk factors for suicide include things like mental health problems, like depression, anxiety, or substance abuse. Those are all risk factors for suicide that underlie and may not have even been recognized at the time the person dies by suicide. Psychological traits that present a risk for suicide are the tendency to interpret life's events in black and white or catastrophic ways, to be impulsive, aggressive, or extremely perfectionistic, and those don't allow us to be as flexible and to cope quite as well with life stressors. Past history can really put somebody at risk for suicide in a way that becomes an invisible layer because it might have happened many years ago. Things like a past history of childhood abuse or a past history of severe brain injury, past history of personal suicide attempts, certainly, or a family history of a suicide. Those are all historical events that place a person at higher risk for suicide. On top of all of those underlying risk factors that can be quite invisible to people around that person, of course there are life events going on for all of us, stressful things that we're dealing with. And so for individuals who have some of those underlying risk factors, those stressors that they're facing in their current day life can absolutely precipitate a crisis. One of the biggest risk factors when it comes to suicide are mental health problems. What research shows is that 9 out of 10 people who have died by suicide did have a diagnosable mental health problem at the time of their death. It may or may not have been recognized or been treated. And so that means we really need to look out for one another. We need to learn the warning signs for suicide risk and know what to do when we see that. Just like we do for CPR or first aid, we can recognize when somebody is suffering from a heart attack or another physical illness in a crisis. So some of the warning signs for suicide are changes in behavior. The people around you that you've gotten to know well, in your family or in your friends group, they have patterns of behavior. And when those patterns change significantly, take note of that. Speak to them if you're concerned. Some of those symptoms look like changes like this: withdrawing socially, isolating from you or from their normal life activities, becoming agitated or easily angered, which we don't often associate with depression or suicide risk, but agitation absolutely is a very common experience when it comes to people who are feeling suicidal. Increase in anxiety, changes in sleep patterns, appetite, those are all warning signs that the person's mental mental health is deteriorating. Certainly if they begin expressing any thoughts about life being not worth living, or thoughts of ending their life, or even if they're not saying it, but they're doing things that seem odd, like giving their belongings away, those should all be taken very seriously. And if you notice things like that, certainly speak to the person in a caring way, and you can also lead them to help. Unfortunately, there's a lot of stigma attached to these kinds of experiences that relate to mental health. So many of us actually hide or cloak the distress that we're in. We keep our experiences very internal rather than reaching out and connecting with support. We need to do everything we can as the role that you have in your family and in society to shatter the stigma, to talk about mental health as any aspect of health like any other, and to approach people that you're concerned about and be open with what's going on in your own life as well. Having the risk factors that I just went over does not mean that a person will die by suicide, but it does mean that we need to do a better job of looking out for one another. There are also protective factors that come into play, and that we can think about shoring up for ourselves and helping our loved ones to improve upon as well. Those protective factors against suicide risk include things like feeling connected to your family, to friends, and to your community. Having a regular source of health care, including mental health care, and feeling supported in that. Learning good coping strategies in life is very important, and we can start teaching our kids that at a pretty early age. The last protective factor is knowing the signs that you are needing to seek help. It's a smart and courageous thing to do. It's not a sign of weakness to reach out and get help when you need it.
Any thoughts? So I think that goes back to, I have 5 children. So, right, you hit the age of 12 to 18, and there's just such a difference in your child, right? They're growing up, they're experiencing their own thing, they get pushed back a little bit more, they may have a poor attitude, they may want to do things that you're saying no to. And so oftentimes when we're focusing on normal adolescent mood swings and whatnot, we sometimes miss things that are warning, or the risk factors, or things that you might be that you might be brushing off because you're just attributing it to normal adolescent behavior. And I think if you notice a change in behavior, if you notice something that's really out of the ordinary, the best thing to do is have a conversation with your child about it, right? And ask the questions and see if there's something that is bothering them that might be other than just hormones changing. To see if that's something that might be an issue. So now we're going to change a little bit and going from the risk factors to the warning signs. So risk factors, as we discussed, can be very subtle. It can be things that you just don't notice unless you're really paying attention. When you get into the warning signs, those are normally more observable, and there's something that may put you on alert of imminent risk. So changes in behavior, which I think you just heard, withdrawing, easily angered, anxiety, all these things are signs that something might be going on that's more than just a normal adolescent behavior. So we're going to talk about 3 things. We're going to talk about talk, behavior, and mood. Those are the 3 items we're going to address next, where you'll see some warning signs. So the first one is talk. If someone's talking about killing themselves, having no reason to live, if they're making statements like, there's no way out of this, I can't take it anymore, I can't take this pain anymore, those are all signs that that person is suffering from something severe, and it's something that needs to be addressed. Being a burden to others, feeling trapped. And keep in mind, I always think of talk as verbal, but I just want to stress so much that texting, posts, all those things are ways that our children communicate today, and you really need to pay attention to both. So that's going to take us into behavior. So especially if it's related to a painful event, you know, the loss of a grandparent, the loss of a family dog, divorce. There's so many things that happen that cause children pain, and they don't know how to express it. They don't know how to deal with it, so it comes out with maybe increased alcohol or drug use. Online searches for suicide methods is a huge flag, and it's ridiculous what you can find online on that topic. It's frightening. Acting recklessly, driving too fast. I don't know if most of your kids are in high school here or middle school, but, you know, maybe riding their bike in areas where they know that they shouldn't. Isolating from family and friends, going silent on social media, saying goodbye or giving away prized possessions. And once again, that can be a really subtle thing. You don't even notice that they're doing it because they're not having a party and saying, here. They're just silently giving things to people that they want them to have. So that giving away possessions. Picking fights is another huge and aggressive behavior, especially out of a child that's normally not an aggressive person. So that's definitely a warning sign. Any questions on that? Insomnia, too much sleep, too little sleep, all those things are signs. So that's going to take us to mood. So depression, and these, the first 6, I think you expect. Depression, loss of interest, rage, irritability, we've talked about all those. Now if you have someone that's, and this is adults or children, that's having great depression and then all of a sudden they're happy. All of a sudden the sun is shining, they're in a great mood, and you think, oh my gosh, this person is doing so much better. When the reality is they may have made a plan for suicide, and the relief of knowing that that plan is in place brings them such relief that they do appear to be happier. So a sudden switch in behavior is something I would definitely say, I would definitely flag and say you need to talk to that person to try and pick up the warning signs. Any questions? So this is a scary one. So 2 out of 3 teens with depression do not get treatment. So that's a statistical fact. That's what research shows. And that's why I think it's so important to do the outreach programs that AFSP offers. You know, I go into high schools all the time and I do presentations in health classes that last 1 period, and it gives them the resources to know what to do. It helps them identify if they're in trouble, and it just gives them knowledge, right? Because sometimes they're not even aware that they're in crisis. They're not even self-aware to say, hey, wait, something's not quite right. And that's also, that education normalizes mental health treatment, which is going to be a theme for me throughout this whole thing, because I think the more we normalize this, the more people are going to recognize it, and the freer they're going to feel to find that help that they need. You know, 60 years ago when my grandmother died of ovarian cancer, nobody said the word ovarian. You know, they didn't even say the word cancer. It was hush-hush. It took me, I think I was in my 20s when I finally figured out what she passed away from. The bottom line is, today you see commercials. You see, you know, it's breast cancer health aware, you know, test months. Go and get tested. Everywhere there's pink. It's been normalized, and we need to do the same thing with mental health. And these programs are one of the best ways to do that. So treatment. So that's something I think that often intimidates people, right? If you're going to taking your child to the pediatrician, you know exactly what to expect, right? They're going to take their weight, their height, their temperature. You know exactly what to expect. When someone is searching for treatment for mental health, it's something for many of us that's an unknown factor, right? We don't know what to expect. But depressed teens show improvement within 4 to 6 weeks of receiving psychotherapy alone. So just talking to someone brings them such relief. Many teens experience significant reduction of symptoms with some form of antidepressant in combination with talk therapy. So medication is usually essential in treating severe depression and other serious mental health conditions. What I usually say to kids about this, because this is part of the presentation, is, you know, sometimes you go in and you may have talk therapy only and it works brilliantly. Sometimes you might need the combination of that with the medication for a period of time. And sometimes, like somebody who has diabetes, you may need that medication for the rest of your life in order to level out your different hormones. That's okay. if you had a diabetic child, would you give them insulin every day? Sure. You know, that would be the normal course. It is the same with a mental health issue. There's no difference other than how we perceive it. So treatment for 8 out of 10 people with depression is effective. You know, once again, the length with the combination is, it's not going to be the same for any two people. Everybody's going to need a different combination because we're all individuals. And so what works for one person may not work for another, and that's okay. It's whatever that person needs. And, you know, you could have depression once and never have it again in your life. Or it could be something that's a reoccurring event. You know, it comes and it goes. It could be something that's constantly there. Everybody's completely different in this area. There's no two people alike, so there's no two treatments alike. And like talk therapy, I don't know if anyone's ever gone through it, but you know, it's basically sitting down and really just having a conversation with somebody and being able to say anything and have that person accept what you're saying and then help them find ways to cope and coping mechanisms so that then they can recognize when they're in trouble and they know some tools, they have tools that will help them find their way back. So living a healthy lifestyle. So this is one of my favorites because I think people separate a healthy lifestyle from a healthy mental, right? You can't separate your mental well-being from your physical. And when I go into schools, I always say, so if you're going to improve your mental well-being, what would you do? And I get crickets, right? When I say, what would you do physically, I would go jogging. I'm going to eat a great balanced meal. I'm going to eat my vegetables. You know, there's a bazillion answers. And I say those two things, you said exactly what you need for your mental health, right? So they are hand in hand. You can't separate them. Exercise, regular sleep, yoga, all those things are great. And that's where, you know, families, you guys are all lucky enough to still have young kids. I'm kind of jealous on that front. Miss having little ones around. But, you know, you guys can go out for nature walks. You can do things as a family, picnics, you know, something along those lines. I know where we live, we have free movies in the park over the summer. You know, just fun things you can do as a family that get you away from the screen and get you doing something different. So finding a mental health professional that's a good fit for your child is just the most important thing. I will say that, you know, sometimes the first person you see is not a good fit, and that's okay. Second person, maybe not so much. Third, oh my gosh, I found the person that I can relate to. That's okay. And I think sometimes kids get very depressed or despondent because they feel like, well, I went to somebody, they didn't help me at all, I am hopeless. No. Anybody who seeks therapy, 9 times out of 10, you might have to go through 1 or 2 people until you find the right person for you. And therapists are not going to be insulted. They recognize that if you say, you know what, this isn't quite right for us, they might even be able to help you find somebody that relates to your child better or yourself. So being vigilant if a medication is started. The medications have very prescribed, defined times and amounts and everything. You need to be very vigilant in making sure that they're taking them when they're supposed to be. Staying in contact with the school counselor, so important because they're seeing your child just as much as you are. So it's so important that they know what's going on. And be patient. You know, this is something that is not easy. It is not something that is easily defined. So be patient with yourself, be patient with your child. You'll get to the other side working together and being open. Any questions? Okay, barriers for treatments for teens. So sometimes the symptoms simply aren't recognized as sign of possible health conditions and they're dismissed. Even by the person themselves, they don't recognize that they're having any mental health issues. A lot of times fear. What is the treatment like? You know, what are they going to do? You see crazy things on TV, right? And there's stuff posted on the web and everything else. So there's a sense of fear. I think sometimes kids feel hopeless. Like they just don't feel like anyone can help them. They're just so despondent, they're so depressed, that even if you suggested a therapist, they're going to say no, because in their mind, nobody can help them. They're just lost. I think also, and I stress this tremendously during my presentation, if you seek help, that is a sign of strength. That is a sign of someone who's saying, hey, at this point in my life, I need some assistance. And that's completely acceptable. So it is not a sign of weakness, it is a sign of strength, and it's a sign of self-awareness. And I think, once again, I'm going to keep going back, having those talks in schools, normalizing it, making sure kids know that resources are out there are just so helpful and so important. There's also the issue of maybe they think adults will not understand, right? They think that they're going to brush them off, they're busy, they're doing this, they're doing that. You know, I had 5 kids. Somebody came, I had a rule, if you're not, well, I'm not going to say my rule because I'm being recorded, but, you know, you brush it off. You just think, you know, you can just shake that off and keep going. But with mental health issues, you really have to be aware. And the one thing that I like to tell the kids is, you know, you have trusted adults out there. You have people that you can reach out to. If you feel like mom and dad might not be hearing you, you have coaches, you have school counselors. It could be your best friend's mom. It could be your mom's best friend. But there are other people out there that if you want to talk to someone and you don't feel like you're getting the right response, there's other people out there. It's just making sure that they're aware that those people would care and would want to know. So how can you keep your child safe? So first things first, receiving that effective mental health care, that's just a huge requirement. Making sure your child receives that mental health care is a great deal, and then strong family connections to friends in the community also play a very key role. Maintaining a safe and supportive home where it's always okay to reach out. I think, you know, believe it or not, 51% of all suicides occur via some form of firearms. So if you have firearms in the home, that's fine, but just make sure you're a responsible gun owner. Lock them up, make sure that you have the key that's not accessible to your children. If you have a child that's in crisis, you know, where it's an imminent threat, you might want to think about maybe relocating those firearms to another location until this passes, you know. And that's not just to say it's only firearms. If you've ever noticed, like, pills today come in like packets where you have to punch it through, you know, versus a bottle. I don't know if you've ever noticed that, but that buys a person time. If you have a bottle, you can just dump them out. If you have a pill pack, you have to sit there and you have to push through all those pills. Time is the biggest gift you can give to someone in crisis. Time is the most important thing. So, any questions? So early identification and treatment of depression really helps reduce the risk. We talked about, you know, I think also another element is if parents actually say, well, I need some help. Like if you're feeling stressed, it's not something to hide. If you're talking to a therapist, it's not something to hide. It normalizes it for your child so that they know that's okay. That's okay if we need to talk to someone. That's okay if we need to talk to a therapist. I think that sharing of information gives them strength and it makes you look stronger as well because you're willing to share it with them. Okay, so we're going to try this again. Here's another clip. And I'm going to put this up.
If you're concerned about someone who may be struggling in your life, the right thing to do is to open up a caring conversation and ask them how they're doing. Ask them directly about whether they're having suicidal thoughts. That will not plant the idea or make somebody at increased risk for suicide. Once you hear what's going on with them, and if you remain concerned, then the next thing that's very important is to talk to them about seeking help and to reaching out beyond just help from friends. If the person expresses any thoughts about ending their life, people being better off without them, or extreme desperation or hopelessness, the right thing to actually do is to reach out for urgent help. And you can do that by calling 911, taking them to a local emergency department, or calling the National Suicide Prevention Lifeline at 1-800-273-TALK. If you are worried that your own health is deteriorating, or you're not sure what's going on but you just don't feel yourself, the right thing to do is to talk to somebody you trust. That could also include your primary care physician, where you might think about getting a referral to a mental health professional.
Okay. So, if you feel someone's at risk, that initial reaching out can be somewhat awkward, right? You want to make sure you're talking to them in private. You don't want to do it in a public space or with a lot of family around. You want to listen more than anything. You know, just listening to the person and giving them your full undivided attention is just a huge boon. Express concern, caring, and then you have to listen in a way that's not judgmental. And as parents, that can be so hard, right? But whatever they're saying to you is their reality. Whatever they're saying to you is how they're feeling. No matter how you feel about it, you have to be as non-judgmental as possible so that they feel free to express themselves. And then take them for a mental health assessment. And as she said, asking someone, are you thinking about suicide? And if the answer is yes, do you have a plan? If the answer is yes, those are huge signs that you're in crisis. You've surpassed where we are now. That is not going to be putting the idea in their mind. That idea is already there. It's not going to be placing it. So I think those are things that we're hesitant to ask, right? We don't even want to say that word, suicide, because, the horror of it. But you have to talk about it. And if you feel like if you're feeling like maybe there's an issue, trust your gut. And that's later in this presentation. It's actually the next one. So trust your gut. Assume you're the only person who's going to reach out. Sometimes people put off things because they think, well, someone else will ask the question. I don't need to do that. We had a teacher in one of the schools that I did a presentation in, and she told the story of a student who came in and she brought her these lovely cookies, and she said something really odd, and she was scratching her head. It was just oddly put, and I can't remember the exact words. But the teacher asked her, are you okay? And she didn't answer, and she's like, well, are you thinking about suicide? And the answer was yes. That story always chokes me up. So trust your gut. Because that teacher, the answer was yes. And she did save that child's life by asking. So if you got the question in your head, if it's popping up that it just doesn't seem right, what does it hurt to ask, are you doing okay? And then taking it from there. So the other thing is avoid minimizing their feelings. If someone is expressing depression, if they're expressing something to you, even if it seems silly, if it seems very trivial to you, you don't minimize how they're feeling. Try to avoid convincing them that life's worth living. If someone was having a heart attack in front of you, right, you're not going to go on about diet and health and exercise. You're going to get that person help. You're going to do CPR. If someone is at a crisis point with suicide, telling them that life will get better, that the roses will come out tomorrow, that's not going to help them in that moment. Once again, as a mom, I love to fix everything. You come to me with a problem, I am the fixer. That cannot be the case because you can't fix this. This is going to be fixed through therapy, through maybe medication, through different things that you're not going to be able to offer. So by just listening, which is so hard as a parent, right? And then trying to find them the help that they need. So how can talking to your child? So take it seriously and don't wait to act. Don't wait till the next day. If you feel someone's in imminent danger, them sleeping on it is not going to help. So take action as soon as possible. Have you ever felt so bad that you had thoughts of suicide? Will not put that in their head, which we've talked about. And reassure your child that you're going to get them help, that they're not alone, that you are their advocate, and that you will help them find that resource so that they can move on from where they are right now. And a stressor, once again, it may seem very small to you, is not something that's obviously small to them. So just being very cognizant about that. You know, validate their feelings. Let them know that you care. So if your child's having thoughts of suicide, there are definitely some steps. Most important is stay calm as you possibly can when you hear those words. It's very unsettling. Thank them for having the courage to come and talk to you, and reassure them that you're going to find the help that they need. Contacting a mental health professional for an evaluation as soon as possible, and sometimes that's hard to do. I don't know if anyone's ever tried to find a therapist. I've tried to help people find therapists. It's actually very challenging, and right now after COVID, a lot of people like doing it remotely. I think you have to find what's right for you. It may take a little bit more of a push on your part to find that person, but they are out there. And then at that point, if someone has thoughts of suicide, I would definitely secure all lethal means from your home. You know, button it down, take all the medications out, take firearms out of your home, or make sure they're definitely locked up in a way that nobody could get to them. Pills, anything along those lines that you think might be attempting, that could be lethal, then I would say lock them up and get them out of your home. So determining if your child is in crisis. So if you find a suicide note, obviously that is a child that's in crisis. If they have told you they have a planned out of how they would kill themselves, if they're hearing voices that tell them that they need to kill themselves, if they're hearing voices in their head, and if they've done a non-lethal attempt. So that might be, you know, cutting, self-cutting, heavy scratching, things that are harming them. They may take some pills, but not that many. Those are attempts, but they're non-lethal attempts. They're cries for help. So, and once again, just trust your gut. So, child in crisis. So, the first thing I would do is I would take them to an emergency room if this is the point where they've said, I have suicidal thoughts, I have a plan. I would take them to the emergency room or another facility where they can be evaluated. You could call 988, which is the Suicide and Crisis Helpline. Do not leave the person alone. You want to stay with that person. And even if they're refusing, that they're saying they don't need help, that's a situation where you actually don't listen, right? You need to get that person the help that they need. Any questions? So addressing your concerns about suicide directly with compassion for your child is an important message. You may notice risks in their friends. You may notice behavior in their friends that have changed. Maybe they've stopped posting, like your son or daughter says, you know what, it's so weird, this person, they used to post me all the time, we would get online and do the gaming together, and now they don't want to do it anymore. If that goes on for an extended period of time, that might be a warning. If any of their friends are worried about it, or if any way that child expresses suicide, that would be a warning sign. And when I do this presentation for the schools, oftentimes, and this is where it gets sticky, friends make promises. You can tell me anything and I won't tell anyone. Well, if suicide comes up and I just promised I wouldn't tell anybody, but now I'm incredibly concerned about them, that puts that child in a horrible position. So one of the things we talk about in the presentation is don't make a promise, and if you do, you need to break it. So that's something that if I think that's something really important to talk to your child about, is if someone ever says that is alarming to you, the best thing you can do is come to me, and then we'll decide together whether I think we need to go talk to somebody else or talk to their mom. Any questions? So for emergencies, call 911. And some police departments actually have officers that have been trained in mental health issues. So if you call 911 and you make that request, I can't guarantee it, but there are officers out there that have been trained for mental health situations. Another resource, so for 988 Suicide and Crisis Lifeline, the 988 number, that's answered, I believe, 24/7, crisis text line. And the one thing that I love, and it's not on here, is there's an app called the Not Okay app. That's what it's called. And you download it on your phone, you put 5 people in it, and if you're not feeling okay, you can hit the button and a message goes out to those 5 people saying, Celeste is not feeling okay, you need to reach out to her. And it's such a simple thing, but it's such a helpful thing. Because then they don't have to verbally call anybody. All they have to do is open the app, hit the button, and that message goes out. So I always like to mention that. And honestly, I think giving our kids these numbers and making sure they're aware of 988, I don't think that that's an issue either. I think that gives them another resource if they're not comfortable coming to you or coming to another adult. That gives them another resource. So, oh yeah, no problem. Talk saves lives. All it takes is one caring, compassionate adult to take notice and start the conversation. And, that person could be you. So do you have any questions for me? Okay, well, I really do appreciate your time and your attention. Thank you so much. I hope that was helpful. Well, I'm passing the baton.
Thank you so much. I also wanted to share, before I pass the baton over to Julia, there are a lot of materials. I know that Celeste was sharing about, like, the 988, the suicide prevention line. I have magnets, I have cards, I have some other flyers with our crisis services for Washington County, all available at the table behind us over here in front of the food. So after the presentations, I will, be over there if anyone has any additional questions as well, just simply about, county resources and, as a school counselor, who do I refer to and where do we go, and just any questions you might have as well. Okay? All right.
Thank you. I might just put it, if it'll stay on my, it might stay.
sorry, the mic wasn't on. So as we talked about several times, a lot of the times when kids come to us feeling depressed, depending on their age, they know what suicide is. They may have known someone that has committed suicide at that point in their life, unfortunately. They may have had friends talk about it or feeling suicidal or having self-harming thoughts. It's okay to talk about it. That's what you want to do if someone is saying something about being suicidal. You want to talk about it. So talking about it is a positive thing. Okay, now I'm going backwards. Okay, another one is only youth who are depressed attempt suicide. There's lots of mental health diagnoses that you can have: depression, anxiety, bipolar. I feel like at this point as well, I've seen multiple people have been diagnosed with schizophrenia younger and younger at this point, so under the age of 18 as well. So, you know, depending on what's going on in this person's life, they don't only have to be depressed. Only a certain type of person attempts a suicide or dies by suicide. That's false. Anyone can do it, unfortunately. Suicide is not preventable. It's preventable with certain things. Like, we want to receive that treatment to help us get to a point where we're not having those suicidal thoughts. We can keep our kids safe by doing sweeps through the house, safety sweeps, kind of locking up sharps, and we'll talk a little bit more about all that stuff, especially if they're having these thoughts. So a couple other ones: people who threaten suicide or seeking attention. It's been known that people do make suicidal statements when they are seeking attention, but it's most definitely not always the case. Can it be? Yes, especially in a teenager's head. They can receive that attention, but we never want to take that risk that that's the only reason why they're saying these statements. Young people with thoughts of suicide or depressed, kind of like I said before, all young people thinking about suicide cannot help themselves. That's kind of like we as parents, teachers, professionals come in. Sometimes a young person, especially if they're still in high school or even middle school, they can't help themselves. They don't know anything about insurance. They don't know anything about how to start getting treatment. So that's kind of where we come in. Young people thinking about suicide are insane or mentally ill. That's incorrect. Our mental health is going to start somewhere. Sometimes maybe it starts with depression, and we're having those thoughts immediately when we're starting to feel those effects of depression. And then most suicides occur in the winter months when the weather is poor. Everyone says the seasonal depression, but it can occur at any point in time. So signs of depression in teens. Isolation seems to be the biggest one I feel like I personally see. Kids stay in their rooms. Kids maybe start missing sports or school clubs. They're just completely isolating to themselves. They're not having that contact with family anymore. Mood swings, self-harming thoughts is a big one. Tired and loss of energy, poor hygiene. This is something I've seen increase in teens as well. Struggling to shower, maybe struggling to eat, maybe just when we're eating, maybe they're just nibbling to kind of keep them going, but they're not actually having meals. Low self-esteem, and then feeling worthlessness or helplessness. So actions to avoid. This is a big one. So kind of going what Celeste said about the promises. Never promise anything that can't be delivered. So sometimes we hear, I promise we won't have to call this person, or I promise that we don't have to do anything or go anywhere. But that's not always the case. The number one goal is to keep your child safe, whether that's going to the emergency room or having them talk to someone else. You know, we don't want to disobey their trust either and have them not trust you after that event. Lessen or ignore child's suicidal ideations. So if they're telling you and talking to you about these self-harming thoughts or these suicidal ideations, listen to them. Take them seriously. We don't want to ignore what they're saying. Try to avoid sounding or presenting as shocked information. So that's kind of like where we want to stay calm. It's not easy for us as adults to stay calm, especially if you never had that conversation or your kid comes to you and says, I want to kill myself. Because in my position, if my daughter ever said that to me, I do this daily with any other kid, but it's going to be different in my situation with my daughter. So, you know, going off of trying to stay calm, they're going to watch your reaction. They want that support from you. So just take a deep breath and continue talking to them. Arguing with someone that may be suicidal, don't say you're not. Listen to them, have that conversation, and then don't tell them you know how they feel. Every person that is feeling suicidal feels a different way. They're going to have different thoughts and feelings why they're feeling this way. So you saying, I know how you feel, sometimes can be a big trigger, especially to teens, because if you're mom, you don't know how I feel. So, a couple other ones are concerned by periods of long silence. Silence is a good thing. Sometimes it can allow a thinking period. So sometimes when we rush someone, they're going to get more frustrated. They're not going to want to talk to you or communicate anymore. Just sitting there waiting for them to be ready sometimes can be beneficial. Ignoring your intuition about their behavior. You know their schedules. You know when something's going on most of the time. Just watch for those types of things. If you're feeling like something's going wrong, feel like that's your cue to either talk to them or talk to someone else regarding their behaviors. Trying to handle the situation alone. You're not alone. You got lots of resources, and we'll talk about some at the end. But don't ever feel like you have to go through it alone. You always want to involve someone else, especially when it comes to the suicidal thoughts, because that's big. And then avoid talking about an attempt that was made by a child. So if someone had a past attempt, bringing it up can kind of re-trigger them. Like you're only thinking of that one. You're not listening to me. Focus on what's going on in that moment, that present moment. Yes, someone may have struggled in the past. Yes, someone has self-harming behaviors, or they may have attempted your child in the past. But focus on that moment. Focus on how they're feeling and what their thoughts are there. Okay, so we're going to kind of transition a little bit. I was asked to present a little bit about bullying. So we're going to kind of transition, and I'll tie everything together at the end. Bullying, a couple of different kinds: physical, emotional, and verbal. We're seeing more, as crisis workers going into the schools, we're seeing and hearing more bullying than ever right now, unfortunately. Some of it is in person. So 1 in 5 high school students reported being bullied at school in the last year. And these statistics were from the end of 2023. So we're thinking the year 2022. 1 in 5 is a lot. On the other hand, 1 in 6 are reporting being cyberbullying. Being cyberbullied. So when we think of bullying, we're thinking of something that they are categorizing. When it took the statistics, it took a lot of verbal communication. Maybe they were being called names. Maybe they were being pushed in the hallway. Social media, maybe they were getting messages from other people, or there were statements being made towards them. So these are all things that were categorized under the bullying. So when we're thinking about bullying communication as well, sometimes some things said to monitor your child's stuff, but when it comes to bullying and tying, like thinking of depression and stuff, sometimes you're going to see if a child's being bullied, you may see your child start posting things on social media about how their responses at that bullying. I hope that made sense. So maybe they're sharing different posts about the effects of how they feel. So signs of bullying, if you watch the kids, anxiety and depression seem to be pretty high when someone's experiencing bullying. Appetite changes, nightmares, moodier, or they're easily upset. And the biggest one is avoiding certain situations or places. So if they're trying to avoid school all of a sudden, if they're trying to avoid clubs or sports, there might be something going on within that team. So supporting your child, couple different ways. Teaching them how to handle bullying, setting boundaries with electronics, encourage communication, and display comfort and support. It's going to kind of go along with the next slide, so that's being involved. So the stigma, and this is where we're going to tie everything together. So the stigma is big, and this is for bullying and when we think of suicide and mental health in general. There's this big stigma that it's not okay to receive some type of mental health treatment when it is. I've worked with kids who I've recommended them do some type of therapy, and they absolutely positively refuse to do anything at school because there's a stigma still around that kids cannot do therapy or they may get bullied. So unfortunately, it's kind of talking to the kids about the stigma. A lot of kids do it. It's okay. Communication. Ask them open-ended questions, and this is for both things. Ask them how they're doing. Ask them if they're being bullied. Asking these questions, it's okay to do. Encourage confidence, and then actively listen. So we're going to kind of talk about a little bit about your local crisis, and that would be us. We're Washington County Crisis. So we work with different providers in the area. We work with, a lot of the times, Resolve. If someone accidentally calls Resolve, we get Resolve calls daily. They transfer the calls down to us. 988 also transfers calls to us when you call 988, and we'll talk a little bit on the next slide of how they determine if they transfer the calls or not. We get calls to doctors' offices. We get calls from the police. We get calls to the hospitals. We also do our assessments in the hospitals daily. Schools. So like I said, we have 2 adolescent caseworkers. I'm one of them. I'm kind of more the behind-the-scenes person. I do a lot of the talking with the counselors and stuff after the initial face-to-face assessment. And my coworker does more of the face-to-face assessments with the kids, but we're here. So, face-to-face assessment. So what we do is we do safety assessments as your local county crisis. So we come in, we talk to your kid, we are trying to make sure they are safe, or the people around them will be safe. So when they are making these comments, maybe it's initially a joke, I want to die, maybe they just told their friend that. Either way, we're coming in and we're making sure they're going to be safe. After we complete our assessment, we make a recommendation. Our recommendations go from outpatient services to maybe if they need to be in a partial program to maybe they need an evaluation at the hospital. Not all the time are we going to send them straight to the hospital. And when we send them to the hospital, that's because we couldn't confirm their safety or someone around them. And they would just get that formal evaluation from a doctor. We're not doctors by no means. We just do the safety assessment piece, and then a doctor would do the mental health evaluation, and then they would make a recommendation. Sometimes we send people up there, doctor says, okay, go home. Other times they'll discuss inpatient options with the parent. Okay, how to seek help. So 988 is a great option, but let me start off. 911, if there's ever an emergency, call 911. 911 has the capability of also transferring calls to us when they deem it's a mental health crisis. 988 is the National Suicide Hotline. You can always call them. When they feel like they need more of an in-person, face-to-face assessment, that's a lot of the times when the calls will be transferred to us. 988 doesn't have the capability of going to your house, going into the community or the school to do those assessments, but we do. So we get a lot of calls transferred to us. This is our local number for Washington County Crisis. So we do telephone calls, we do the face-to-face assessments, and we do follow-ups. We check in a couple days later with you, or if it happens at school, a lot of the times we check if there's some other stuff going on with school stuff, just to verify everyone's doing okay. If it's a no, we're struggling still, we'll follow up a couple more times. We want to make sure you're in a good place before we end that service. We're a short-term service, but we're here for the crisis. So if something would come back up, we would encourage you to call again. The other number I forgot to put on here that I didn't think about, I apologize. It's CCR. So there are a base service unit in Washington County. They are a great resource. So if you're having trouble getting any type of therapy, or any type of mental health services, they would be able to assist. Their full name is Center for Community Resources. They just go by CCR. If you want the phone number, I do have the phone number afterwards. I can give it to you guys. But they'll help you if you are having trouble with your insurance, can't find a place that's taking it. If you're interested in school-based, they'll also assist with that. But they help you get that support that you need that you might be struggling to get on your own. Okay. Any questions? Resolve is Allegheny County's Resolve. It's their crisis. It's just labeled Resolve. A lot of the times people just know Resolve and call Resolve, and they just get transferred to us because they're not their local crisis number. We work hand in hand with them, along with same with the other crisis numbers in the other local counties. So you have like Fayette, who's through Chestnut Ridge. So like when there's a call and it's not in the correct county, everything gets transferred to the right county so they can be better served.
I have a question.
Yeah.
Unless you know that parents are directly involved in whatever crisis
Mm-hmm.
the child is involved in, is it your goal to keep the parents involved in any kind of services that you're offering to minors?
So it all depends. So in a school setting, we always encourage the parents are made notified. If they're under the age of 14, we have to have parental consent under the age of 14. In the state of Pennsylvania, you have a right to make your own decisions 14 and over. So you are able to call us and talk to us. What we do is we ask, say, if you're just calling the hotline and you're over the age of 14, we'll still ask for a parent phone number. We'll ask for your address. Like, we get the demographics in case there would be some type of an emergency where we do need to reach out to someone further. Over the age of 14, you have a right to request that a parent isn't made aware. It's just, yeah, the age of 14. So, but, you know, when it comes to safety reasons, if someone who is 16 years old called, had a plan to kill themselves, can't confirm safety, you know, we go through all our protocol on our end. We're not just going to hang up the phone. We're going to go through our safety protocol. We're going to reach out to a parent. We might reach out to the police. We might go, you know, make an arrangement to come meet with that kid. If we're coming to the home, we don't, us as Washington County Crisis, we're not going to come to your without a parent being there or a guardian being there. There'll always be someone there. If we have to send police first, if there's this immediate threat, then that's what we'll do. But safety does come first. So if there's that immediate threat, we will make sure, you know, something does happen. Does that make sense? Okay, perfect. Anything else? Okay.
Well, this is a microphone so that we can record it so it's recorded on the computer. Is that okay?
Of course.
Sure.
Just put it right down here.
Okay.
Will that pick it up well enough? No, dear, no. I just have me. In fact, I wish we could get closer, but if they don't feel comfortable, I know how people are. They don't want to move when they've already sat down.
Mind moving up a little bit closer?
Yeah, could we get like almost like in a circle kind of a thing, or get around the table? Can you push that table closer, and then they could all sit around the table? Because we're going to have a conversation here. I don't have a PowerPoint. I just want to talk with you folks. That's all I'm going to do.
I introduced Dr. Patricia. I introduced you before.
That's
you
all good.
came,
It's all good.
So you know.
I had a busy day, folks. I'm sorry. I teach at W&J, and I took a psych class just last week because the professor couldn't finish it. So I had that class, and then I had my regular education class. So
that's why I'm here. Although I let everybody go early so I could get here. They didn't seem to mind. Students are like, hey, I'm done. Bowling Day's a good school. I've been with them 15 years. So, yeah, gather as close as you're comfortable. How about that? And so I'd like to have a conversation with you. I'm not interested in I'm so happy that the people who preceded me have done all the statistic work, because I want to just chat with you. You can call me Mary Jo. Everybody does except the students at W&J, and they call me Dr. P, because that's a rule, but everybody else calls me Mary Jo. I have been, as they say in the fields, a little piece of time. I just had my 74th birthday. I run the Teen Center in town, and I have some literature for you after you can pick up. Teen Center is right by President's Pub in Washington. It's open Monday through Friday, 4 to 8. Tonight they're making ham soup at Cooking Club because I gave them my leftover ham thingy. I couldn't waste, you can't waste that. But nobody in my house will eat it, so I gave it to them, and they made ham and bean soup tonight. Everything I have done for 50-some years is serving young people. And I mentioned my birthday because we just had a 13-year-old. You have to be 13 to 18 to go to the center. And last Thursday night, I was there. I'm always there on Thursdays. And he said, my birthday's on Sunday. I'll be 13. Thanks for letting me come before. And I said, that's my birthday, too. We're birthday buddies. He said, how old are you? And I said, 74. And he went, I felt like saying, close your mouth, honey. So when I had chemo, I've had some interesting life experiences. I used to color my hair all the time, brown, and I was a lousy looking bald lady. I looked like Charlie Brown. When it came back, it was white. I was just so happy to have hair. I didn't care, and they said don't color it for 6 months. So I thought I'll leave it like this. And I've discovered that people think I know stuff because my hair is white, and they also think I should be retired. They cock their heads like this and go, "Do you still teach?" Like, you poor soul. I teach because it's my passion. My doctorate's in education, my master's is in counseling. So I have a very similar background to you with adolescent crisis. But I have put the last 37 years of my life solidly into prevention education. What I want to talk with you about are three things. I want to know what you need as parents. I assume you're all parents or grandparents, you're people who are here for kids, about the suicide prevention and bullying. I want to give you some reassurance. It's hard to parent, that what you're doing is a good thing, even though some days you think you're not making it. You are. Even the best parents make mistakes. That's called life. And I want to provide our services as a resource to you. So the first thing I need to do is set guidelines or promises. I do this if I'm talking to one teen or 1,000 adults, because I do a lot of professional workshops. So my first guideline is respect. That means I will promise to respect you. Did you do this when you started? Okay, because I don't want to overdo what you did. So that means that nothing you say will upset me. Believe it or not, in this venue, I am quite comfortable with whatever you believe, because I respect you as a human. I believe that every person is a person of worth. You are worthy because you were born. I don't need to know anything else about you except that you're a human person, and I respect that. So that's my first promise. My second promise is we will make a safe space, which means I won't tell anybody what you say. If you really have something deep, dark, and secret to talk to me, my phone number is on here. You can call me, you can text me. I have never stopped taking texts from young people. I do that forever. I made that commitment back in the 70s. I don't turn it off. So that means I've taken call on Christmas Eve. I had a call I'll never forget from a young parent on Christmas Eve, because she and her 7-month-old were at a bar, which is where her mother worked. And she said she had spent her entire childhood in bars, and she didn't want to be at a bar with her daughter on Christmas Eve. And I said, I'm on my way. And my family was like, where are you going? We're Italian, so there's food involved in everything. And don't stop cooking. What are you doing? But I had to get her because she took the time to call me, and I responded to that. So my staff knows we're not there 9 to 5. We make a commitment. We're there for young people. So that's my promise to you as well. I will be confidential with whatever you tell me. I will hold space with you if you need me. Does anybody know what that means, holding space? It is a term that comes from two of my things that I've done in my life. I was a birth doula. Anybody know what a doula is? Yeah? Are you a birth doula? Yay! Sister, right? You need that as much as birth. So yeah, I've been involved with, I've seen thousands of births. And the second is, as a hospice nurse, I've seen many, many deaths. I started as a peds oncology nurse in New York City. We had 10 children die every week. So that changed my entire perspective on life. It had made me look at my own mortality and begin to live intentionally. So I will hold space with you or with your young people or teach you how to hold space. Can I explain it to you how one of the teams at the teen center, I teach them how to hold space. We were talking about our promises for the night, and one of the boys said, I think we should hold space. I said, tell me what that means to you. And he said, supposing your friend is messed up, I assume that means depressed, and you have no idea how to fix it. If you hold space, you sit with them quietly, and you give the gift of your presence. And I said, at 15, my friend, that's pretty good. I'm proud of you. So those are my promises to you tonight, with one more that I think is really key. I will honor whatever choices you've made up to this point as parents or grandparents, because you're doing the best you can. And I'd like to guide you a little bit. These are hard topics. They're really, really hard topics. I'm a certified Oveus bullying prevention trainer. That means I've gone through a whole lot of training to get people to do the Oveus method of bullying prevention. It's the only one that is ridiculous, but it's wonderful. It teaches everybody from administration down to the people who drive the buses how to take care of bullying. Because of that, I have some things that I do with bullying that's a little bit different. One is I never call anybody a bully, and I never use the word victim. I say some students do bully and some students are bullied. I don't put them in slots. It is not true. It's a myth that those who have been bullied then become bullies. It's true that those who bully often enjoy the action of bullying someone else. That's unfortunate, but it's true. And the thing we work with the most for education is how to help the people who aren't bullying, who are bystanding and watching, become defenders, step forward. And that has to come from teachers more than anybody else in the school, because young people don't have the courage to do that alone. So the data on bullying in schools says many people who have experienced bullying say that a teacher knew this was happening. Some of you may have heard that from your young people. That has to stop. You have to create a culture where that's not accepted. That means that as a role model, which I am because I serve young people, I have to be kind. I don't have a choice. There's a lot of things I can't do. We were first married. I said to my husband, I'll never cheat on you. That was 51 years ago. And he said, good, I'm glad. And I said, honey, I'm going to work with teens and they're going to watch me. So everything I do, Emerson said, what you do speaks so loudly, I cannot hear what you say. What we do is what they listen to. What we do is what we teach them. So if we tell jokes that put down people, or we mock somebody, or we turn our heads when somebody is mocking somebody else, our young people see us. If that happens in a school, that reinforces it. So when I say it has to start from the top, if you're going to make a place where young people do not feel alone, do not feel lonely and isolated, then we have to create a culture in a school and in a home where they are seen, they are validated, they know they're worthy. They have to be able to show us how they feel without being afraid. Because what Julia talked about is really important. The scary part is the young people that don't seem to show any signs at all and then take their own lives. So how do we help with that? Not easy, as I said. This is heavy. I also think we misuse the term bullying. Let me explain what I mean by that. I was a young person a long, long time ago, but I remember having difficulty at 12 with people. Did either of you remember 12-year-old friendships are like, people you knew were your friends, oh, you thought for life, and all of a sudden they don't like you at all. You don't know where you belong. Fights happen. That's called growing up. For bullying to be bullying, it involves power. Somebody has more power over another person. It's not an altercation between two 12-year-olds or 15-year-olds. It's power on one end, no power on the other, and it happens over time, which is why young people get so depressed, so withdrawn. Because picture this: if you have to go every day to a place where you know you don't feel safe, would you go? First thing I look at with truancy is what's going on in that school. Why is a young person feeling safe to go there? First thing I look at when grades drop. What changed? Could be something at home. Could be something in school. I expect kids to have times when they falter. That's called living. I wait for that. You're working with postpartum. You go in knowing that there'll be days when that person really needs you. And there'll be days when you're, it's nice that you're there, but the days when you're really needed, that's what you're trained for. So that's what teachers and guidance people like Erin are trained for. They're trained to be there on the days when the kids really need them, but they may not see it. And people are quite good at putting on masks. You as parents may see it. In little things, some of which Julia talked about, if they're off, they're just not the same. Does anybody know what I'm talking about? You raise this kid. No, wait a minute. If they're 13, they're going to be different. I'm sorry. If I had a nickel for every mother who said to me, I want my daughter to be back. I'm sorry. You have to wait. She'll get there. Right now, she doesn't like you very much. She doesn't like herself very much. She's not fond of her friends. It's a passage. She'll get through it. What we don't want to have them do is take their own lives in the process of that passage. Suicide never happens in a vacuum. And you notice I said take your own life. Words matter. I saw this great cartoon the other day, and I thought about bringing it to show you, but I didn't have enough time to make it happen. It's a little child and two adults, and they're talking, and the words aren't words, they're hearts. And then the next panel of the cartoon is the same child, a little bit older, and she is talking, and the words come out of her mouth are hearts. Everything we give them, words, actions, they go inside, and they echo, and they ripple in here. And it's okay to change what you've done already. I tell people all the time with young people to articulate the obvious. Say what's in your heart. Say, you know what? The best thing that ever happened to me was that you were born. I love being your parent. They need us most when they're obnoxious, when they're incredibly difficult to live with, when they grunt. Did you have any grunters? My boy was monosyllabic. He's 39 now. 4 years of high school, all I got out of him was nothing. I'm okay. I'm good. Right? So one day I said to him, when you get out of school today, I want a sentence about what happened today. He had sisters who told me everything. He said, she says, about even not always good stuff, but they told me nothing from him. I said, today when I pick you after school, I want you to tell me something. He got in the car and said the nachos weren't bad. I wanted something deep. I want nacho stuff. Here's the bottom line, though. He did talk to me. Don't say, how was your day? Don't even do that. When Julia said, say open-ended questions, say, did you eat something good today? What was the hardest thing you did today? What really made you mad today? Give them a chance to vent with you. Because the reason they're hard to live with from those ages is because you're the only place they can be themselves. You're the only place they can goof off. You have to love them anyway. And you have to say that. Shrek said that ogres are onions. We're all onions, every single one of us. And young people in adolescence, you get the top layer until they trust you. And you could have raised them to 15 and lost their trust. And it's not because of what you did. It's because of something that happened at school, that happened in a friendship, that they observed from you, that they may, if life goes on, tell you when they're 50, if you all live together long enough. The hard part is getting through each day. In recovery, they talk about one day at a time. That's how you parent. One day at a time. Sometimes during chemo, I told my nurse that I wasn't going to get through one day at a time. I was getting through 1 hour at a time. I was getting through this particular moment, which was hard, because I knew I could. Because I had support. We do a game with the kids in the outreach. We give them popsicle sticks. You may have seen this game. We didn't create it. We have them write the thing that's hurting them right now on one popsicle stick. Have any of you seen this? Yeah. And we tell them to break it. And they break it very quickly. Then we have them get a whole bunch of popsicle sticks and write down everything on each popsicle stick that helps them. It could be a person. It could be sports. And then we put the sticks all together and they can't break them anymore. That actually came from Planet of the Apes, if I'm going to give credit to her. Anybody see Planet of the Apes? He got one stick. He said, ape alone, and he broke the stick. He put all the sticks together. He said, ape together. It's the truth. But our young people don't know. Joy even said that. Put it on the video. Put the people that can help you on a piece of paper and keep it in your wallet. Kids don't have wallets. And they don't put things on paper. They don't always know who can help them. The scariest thing, I think, about being human is the fact that we are alone in our heartness, in our heart, the heart stuff, the stuff that hurts the heart. You can't change that completely, but you have to teach a young person how to seek help, how to find a group that they can hang with. That's why the teen center is important. We need socialization as creatures. We can't survive alone. Very few of us can. So back to what I was saying. Figure out whether it's bullying or not. Stand for your young person. Don't be afraid to do that. Don't be afraid to call the school and say, I'm troubled by this. The school's your partner. They need to be your partner. They need to listen to what's going on. Suicide prevention is a full-time position. It's not, there's no easy answers for it. I believe that the easiest thing to teach and the hardest thing to teach is self-worth. If I can empower a young person to believe that they are worthy, it diminishes the drug and alcohol problems, it diminishes academic challenges. They won't necessarily be in NHS, but they won't give up so easily because they know they're worthwhile. I believe that parents are key to a kid's survival, and I believe parents need support. You can't do this all by yourself. Postpartum's the easy part. You just don't know it at the time. There are two things in my life that got me to where I am and has made me commit literally the last 50 years to serving young people. The first was working at Sloan Kettering, where we had so many deaths of young people. And the second was my 5th month as a doula in 1976. I was pregnant with my first child, who gets really mad when I say that. So if you know her, don't admit that I told her. Her age is not something I should share. I shouldn't put that on there. It's too late now. Anyway, I got a call from a mother who wanted me to be a doula for her daughter, and I started working with teens because of this young woman. And I went to her home. I didn't have any experience in a home visit. I didn't know anything. I just had to go. I went, and she had a blanket over her head. She wouldn't look at me. So I sat down. I said, hi, I'm Mary Jo. I'm going to help you get ready for the birth of your baby, and then I'll be with you. And she said, do you think? She cuffed at me, and I said, I think I'm Mary Jo. I'm going to help you get ready for the birth of your baby. And 2 times after I met her, she went into labor. So I told my husband, because I'm 8 months pregnant, I said, I'll be back in a couple hours. 19 hours later, I came home. She was 12. I've lived 74 years, and I've never lived what she's lived. She had horrible abuse in her life that was not a conceptual, that was a sexual assault, that pregnancy, and she did not keep the baby because of that. She was wise enough to know she wanted her child to have a better life than she had had. After that 19 hours, I didn't want to have a kid. But more than that, I knew I had to do something. So that's how I started teaching sex. It had nothing to do with me wanting to be involved with sexuality education. It was because I wanted to change this. And we did. The Washington Health System Teen Outreach and I started in '88, and the teen pregnancy rate in the county was 39 per thousand for 15 to 17-year-olds. And we stopped teaching in all the schools in 2013, and it was 12 per thousand then. So that's a significant drop. We taught over 330,000 kids in 48 schools in 5 counties. All because of this sweet little 12-year-old who I still hear from. She never misses Mother's Day. I get a card every Mother's Day from her. She also said she didn't want to see the baby or know if it was a boy or girl. So I made everybody in the delivery room be quiet because they usually go, it's a boy, or it gets, and there was no ultrasounds in the 70s. And so I took a picture, and she, about 6 months after the birth, asked me, and I showed the picture to her. And that's what started me on this path. And I have learned so much on this journey that I'm going to repeat the most important thing. You're worthy. Your young people are worthy. Do the best you can every day that you can, and if you think you're floundering in any way, get help. Call these wonderful people. Talk to each other. Make a support system. Pick up the phone. Okay. Don't take it out on your young person. Face yourself from that, whatever emotion that's so powerful. If you're frightened, what you said, Julia, about never ignoring what they say, never ignore what they say. If a kid says in my presence, and they know better, I'm going to kill myself, everybody leave, we have to do some work. I call crisis, I talk to parents, I call parents first. But the bottom line, well, I don't have to follow some of the rules. I don't. You birthed this child. I need to tell you what's happening. After all these years, I have never taught a class without permission forms. Parents have to know. They don't want a kid to know stuff. I'm not going to tell them. Your connection with your young person is what counts. Doesn't mean you like them all the time. You love them, but you don't have to like them. Doesn't mean they like you all the time, but you're connected. You're connected so that you see when they're not acting like themselves. And you say, what Julia said, what's up? What? I'm worried about you. You can say that. You can say, if you do this kind of work like I have, and you teach your own children like that, they throw it right back at you. Like if you have a bad day, my kids will go, hey, Mom, what's going on with you? And I can't lie. I have to say I have a headache. And I have a physician daughter, so she not only notices I have a headache, she analyzes it. She assesses how long did the headache start and where is it exactly on your head. I'm like, just give me an aspirin. Stop doing that. I want to give you hope, but I also want to underscore that this is a big deal. 13-year-olds should not be so alone that they don't think it's worth going on. And not one of us can make this better. This is a group effort. Can you imagine how isolated a person has to be at 13 to give it up? And notice my words. I say take their own life. I don't use commit suicide anymore. Commit suicide sounds like a crime. This is not a crime. I had a significant argument with my priest many years ago. Really mad at him because he said suicide was a sin. And I said, how can you say that? Because no one knows what's in that person's mind at that very moment. And if it's a young person, all I can think about when I hear about a suicide is how did we fail? What did we do? What didn't we do? Which leads me to the last thing I want to give you. Freedom of guilt. There's no such thing as not blaming yourself if you know someone who took their own life. Whether you're professional or a friend or the neighbor or in your family, you do. You do this. What I do wrong? Why didn't I see this? I need you to forgive yourself of that because you're just human and you're doing the best you can. What I hope is that we work together. McGuffey is a community. It has to start from here. It has to start with administration. It has to become something that the culture does. So what anti-bullying means, you know what bullying is. It's not two people having a hard time and roughhousing. It's when somebody's picking on somebody to the point where that person feels isolated and lonely and afraid. My staff and I at Teen Outreach, we read a book every year. I pick one, and we all read it, and we talk about it. And right here, we're reading this year Together by the Surgeon General. It's about loneliness. It talks about how connected loneliness is to depression, how connected it is to anxiety, that if you feel all by yourself, no matter how old you are, it's hard to take the next step. Have you ever felt like you can't get out of bed in the morning? Picture yourself 13 and you feel like that. And everybody's expecting you to get A's and go to school and put up with all the people in your bus who are just annoying as all get out. And sit at lunch. Oh, lunch is a horrible thing for some kids. It really, really is. we play a game that we invented quite some time ago. It's called the Deck of Life. And each card has a symbol. So all the diamonds have to do with finances, and all the hearts have to do with relationships, and the clubs have to do with hard stuff in life. And the spades are things we teach to help you cope. Mindfulness and breathing, all these good things. And the first way you play it is, I made this in 2003, and I started with, I thought the 2 was the easy thing, and the ace would be the hard thing. And the ace of hearts is death. And the 2 of hearts, because I was an adult, was no one to eat with at lunch. And I give them to the kids that we're working with, and they order them. I was shocked how many times the 2 of hearts they put way up here as one of the worst things ever. No one to eat with at lunch. You know, when another one is harsh, no birthdays. We work with kids in foster placement. They don't have birthdays that are honored. So I don't want to take any more time. I want you to ask me or talk with me.